Hi everyone, my name's Alexis Swindle, and this is my poster presentation for Nurse 532. I was really lucky to get the opportunity to work at St. Joseph's Medical Center in their Level 3 NICU since starting in February. And during my time there, I helped to implement a project called Eat, Sleep, Console, improving care of infants suffering from neonatal opiate withdrawal in the NICU. So the purpose behind this project was that currently or previously um, neonatal opiate withdrawal infants, or which was previously they were previously referred to as neonatal abstinence syndrome. Um, they were all being treated with Finnegan's scale, which was super common. Everybody was using it. However, it really was not the best way to care for these babies. Um, it its reliability and validity were never really proven. It was just what was being used, so everybody was using it, and it was resulting in much higher rates of morphine exposure in these infants when they really did not need that. Um, and then it was also resulting in significantly drawn out hospital stays. So when Eat Sleep Control was discovered, and it significantly could lower that morphine exposure and um, the average length of stay. So when we first started implementing another aspect of this project was when we first started implementing Eat, Sleep, Console, especially at St. Joe's in Tacoma, there was very little parent participation. And the purpose behind Eat, Sleep, Console is for the parent to be able to help the baby feed effectively, for them to um, assess whether their baby can sleep for an hour without fussing, and then if they can console their baby in 10 minutes. So we determined that parents weren't really part of the care. It was actually the nurses that were doing most of the implementation of Eat Sleep Console. So we really wanted to focus on promoting that parent participation and making it a daily thing. And our hope was by increasing that parent participation that the length of stay and morphine exposure may decrease even more. Unfortunately, due to COVID-19 and time constraints, we weren't able to see results on this part of the project, but I made a brochure to educate parents on Eat, Sleep, Console and what to expect. And there was also newborn care diaries and other tools for the parents to help them guide them through the care of their baby so they were more comfortable being there. So our global aim for the project was to improve care of now infants, and the specific project aim for CHI and regionally here is by May 1st, 2020, we wanted to have all of the opiate exposed babies in the CHI Franciscan Health System in this region be treated with Eat, Sleep, Console, and all of those that had a diagnosis of NAS or now. And by October 1st, 2020, we hope that 25% of all of these Eat, Sleep, Console cases will include daily parent participation. So as you can see in my key driver diagram here on the bottom left corner, it just goes through kind of what contributes to successfully implementing the project. And so our primary drivers included a few different things, but we really needed buy-in from the staff, from the providers, and from the advanced practice providers, and from the nurses, because it was going to take a little bit more time for the nurses to care for these infants. And also environment was a big one, so low simulation was huge, and the ability for parents to room in so that they could stay there and be comfortable in a space with their baby. So the methodology, we did a review of the data on the neonatal dashboard for CHI regionally around here, and that specifically, the dashboard gave us the average length of stay for the now babies. And we also had hoped to use ICD-10 codes to draw data on parent participation and the amount of morphine doses. But again, due to coronavirus, this data was not able to be collected because some of the people that would have done this, there were furloughs and just time constraints, and so it wasn't able to be completed. But so the average length of stay back to June 2018 was collected, and the data for average length of stay post implementation of Eat, Sleep, Console, so after March 1st, was compared with the average length of stay in the months leading up to implementation. And probably a limitation of this project is all infants with a diagnosis of NOW or NAS were included in the data collection. So that was regardless of gestational age or other significant comorbidities. So if there was one baby that was significantly preterm, their length of stay was going to be much longer, but that still impacted the overall length of stay for NOW babies because they also had a NOW diagnosis. But as you can see, since December 2019, that was at 24.8, but we've been continuously trending down, and March 1st was the go live date. So March 1st, we were down all the way to 11.8 days, and April dropped down to 5. And in the literature, it showed that hospitals sometimes had as high as 22 days for the average length of stay, and they were also able to drop it down to 5. So that's lines up with the literature as well, which is encouraging. We weren't able to get the data wasn't yet released for May, June, and July, but our hope is that it would stay right around that 5-day mark. So our conclusions were that Eat, Sleep, and Console has proven to be an extremely beneficial quality improvement initiative. It has provided a much improved approach to the care of NOW babies and reducing their pharmacological treatments. And it's been successful in all different types of settings across the country, from all the literature, and also in CHI Franciscan alone, because St. Joe's is a level 3 NICU, but there are also other hospitals that are special care nurseries, and they're smaller and they don't have as many resources, and it's been successful in those places as well. Eat, Sleep, Console provides more of an opportunity for parents to be participating in the care, and it allows for infants to have less of an exposure to morphine, and the biggest benefit was the average length of stay. And right now, that was the only data point we were able to see, but we hope to see that in morphine exposure and parent participation as well. And ultimately, things were made a little bit more difficult, like everything nowadays is, due to COVID-19. Time constraints, amount of assistance for data collection, whatever it might be, and my inability to be on site for about 4 or 5 of the months. So, but we were still able to get a lot done, and I'm really appreciative of all the help I received from those at St. Joe's and CHI regionally as well. So, recommendations for future study. There really needs to be studies done on the long-term effects that Eat, Sleep, Console can have on these babies, and if there's anything that's of concern with those long-term effects. In addition, I would really like to see research done on the impact that parent participation has. So if increased parent participation results in even more decreased morphine exposure and average length of stay. And then finally, data needs to continue to be collected at St. Joe's and CHI to see a continuous trend of the reduced average length of stay. So thank you everybody for your time, and before I'm done, I would just really like to give a little thank you to the Quality Improvement Committee at St. Joe's for all the help that they gave me on this project. They really kind of showed me what it was like to produce a quality improvement project. Kim Tanaka, my preceptor, was just about as amazing of a preceptor I could have asked for. And then all the other staff there, and then just my instructors, Dr. Wallace and Dr. Massey, that helped me through this project. Thank you.